Friends, in today's video, we'll talk about human factors in aviation and how does it affect pilots, ATC, all the maintenance crew related to an aircraft. And for human factors today, we are going to talk about hypoxia. So human factors is a study of how humans, in which we can include ATC, pilots, and all the stakeholders who are in aviation field. They will interact with our aircraft system and their environment, and how this will affect aviation safety and performance. Did you know, guys, that 70 to 80% of aviation incidents are related to human factors? So now let's look at the topic hypoxia. When you are flying at high altitude, the danger is not always an engine failure, weather, or turbulence. Sometimes the danger is invisible to you. You may not notice it. So we are talking about hypoxia. So your body is not getting enough oxygen. So your brain isn't functioning. Your body coordination is dysfunctioned. Also slow down in thinking, and you would lose your muscle control and that. So first is, what is hypoxia? As we already talked, it's a lack of oxygen supply to brain, which can occur when you are flying high altitudes, because at high altitude your air pressure would drop. So with lower pressure, there is less oxygen available. So without enough oxygen, your body and your brain cannot function. See from here, how does your air pressure decrease? At first, your air pressure decreases by very small amount, from 100 to 83%. But when you see from 18,000 feet to 25,000 feet, the air pressure decrease is very rapid. So that's why when pilots face a cabin depressurization, they always want to descend to 10,000 feet around. Cabin pressurization. So cabin pressurization is a technique. So when you are at high altitude, let's say 35,000 feet, your cabin is adjusted so you feel like you are at around 8,000 feet. Now, what are its effects on body and brain? So, as we already talked, the body organs and tissues need oxygen to work. So, brain is most sensitive to this loss. How will you recognize it? So, what if your co-pilot or pilot or captain, sorry, gets incapacitated, and you have to identify, is it a symptom of hypoxia? So mild symptoms would be poor judgment, inattentiveness, there would be impaired coordination, and mild euphoria. So euphoria is a feeling of well-being. So this would feel like an unnatural feeling when you notice someone. He or she would be very happy. Recognize this with their speech. So their speech would be not of a normal person. When they speak, they would sound much happier. Now, moderate signs and symptoms are confusion, irrational behavior, poor vision, and headache. Severe symptoms can lead to unconsciousness, loss of muscle control, coma, and death. What must pilot do if you have recognized that you have hypoxia? So, if you are about 10,000 feet in an unpressurized aircraft, so you would use oxygen available, oxygen cylinders. Case in a depressurized aircraft, the aircraft which are not pressurized. So all the airliners have pressurized aircraft because they fly around 350, flight level 350, 290 to 410 flight level. Talk about the key takeaway from this. So at high altitude there is low pressure. Pressure is low. So you have less oxygen in each breath. Your brain is the most affected part. You have to use oxygen, recognize your symptoms, as we talked in these three conditions, and descend to 10,000 feet or less. Now we'll talk about types of hypoxia. So there are four types of hypoxia. The first is hypoxic hypoxia, anemic hypoxia, ischemic or stagnant hypoxia, and histotoxic hypoxia. To remember this, remember hashtag. So remember this word hash. So H is for hypoxic, second A is for anemic, S is for stagnant, H is for histotoxic. So hypoxic hypoxia is caused when your lungs are not getting enough oxygen. As we talked in previous case, when you are going at high altitude, there is low air pressure and less oxygen available for breathing. So this is the example, high altitudes and poor ventilation. And is a case of anemic hypoxia. This is related to blood. Your lungs are getting enough oxygen, but your blood is not able to carry this oxygen. So your hemoglobin has less oxygen carrying capacity. Hemoglobin is that part which carries oxygen in your blood. Is related to blood. So now you can know the symptoms. So it would be caused by heavy bleeding because we are losing blood, so there's no oxygen available. If you have anemia, anemia would be most prominent in who are vegan. Then is sickle cell anemia, and if you have a carbon monoxide poisoning. So carbon monoxide poisoning, why does it happen? So your blood, when we talk about hemoglobin, monoxide has 200 times more affinity to bind with your blood than oxygen. Yeah. Oxide is 200 times more attracted than we talk about the oxygen part. Now we'll talk about ischemic or stagnant hypoxia. As the name suggests, stagnant, it means it's not moving. So there is low blood flow to tissues. So this can be caused when you are having high G maneuver. So let's say you are cruising at an altitude and you pull your yoke column and you experience high G. So in high G maneuvers, your feet and your lower body would get flow and oxygen moving to downward parts, and there would be no oxygen available for your brain caused by inadequate blood flow to tissues, so oxygen cannot reach the cells even if the blood and oxygen levels are normal. So this we already talked, constrictions of blood vessels in cold weather when there is low blood pressure. So some part of your body would not get enough oxygen. If you are in high sustained acceleration in some aircraft maneuvers, like as we see in this diagram, I will talk about the histotoxic hypoxia. From name, you can say toxic means it's related to alcohol. So it's caused by inability of cells to use the available oxygen. So now your all body parts are getting enough oxygen, but they are not able to use this oxygen. So oxygen is present in blood and reaches the tissues, but the cells cannot utilize it. This would happen if you have cyanide poisoning, if you have chemical poisoning, if you are intoxicated with certain drugs, or you have high blood alcohol levels. Remember these four things by the term hash. So first was hypoxic, anemic, stagnant, and histotoxic. Now in hypoxic, your lungs were not getting enough oxygen. In anemic, your blood is not getting enough oxygen. In stagnant, tissues are not getting enough oxygen. In histotoxic, cells are not getting enough oxygen. Hypoxic is caused by altitude hypoxia. Anemic, as the name suggests, you can also include anemia. Stagnant means it's not moving, so it could be related to high G maneuvers. You have low blood pressure. Histotoxic, remember it's caused due to alcohol. So this is an easy trick to remember all the four parts. Now we'll talk about the causes, symptoms, and action. So this drug overdose or alcohol is related to histotoxic. This is related to your anemic hypoxia. Similarly, we have very low blood pressure. This is altitude hypoxia because your air is not reaching lungs properly. If you have cardiac arrest, so the heart will stop and your oxygen delivery will stop immediately. If you have carbon monoxide poisoning, high altitudes, any disease that paralyzes your respiratory system, if you are a tobacco smoker, for tobacco smoker, also remember they can get hypoxia symptoms at very low altitude. So in the night time, they can get hypoxia at 5,000. This is for smokers, and non-smokers will get hypoxia at 10,000 feet. Symptoms, as we already talked, early symptoms were impaired judgment, headache, there is a slow reaction time, night vision impaired, starts above 5,000 feet. So at daytime, you have to descend to 10,000 feet. At night time, if possible, you can descend to 5,000 feet because your night vision would get impaired. And last symptom, this is very important, euphoria feeling. Then moderate symptoms include tingling in hands and feet, hyperventilation, fatigue, memory impairment, and muscular impairment. Severe symptoms include impaired judgment, which will get worse. You have tunnel vision. So, in tunnel vision, you would be only seeing what is in front of you. So, your side vision or your peripheral vision will start disappearing. Then you have sensory loss. Then you have cyanosis. So, it's bluish color of lips, nails, or skin. Last is loss of consciousness, ultimate death. So, what are immediate actions? So, provide oxygen 100% if available and descend to 10,000 feet or below if there is no terrain at 10,000 feet. And you have to act fast because your judgment is affected first. So, if you do not descend 10,000 feet, you may not be able to control your airplane. Now, these four things we already talked in previous slide. Now we'll talk about the carbon monoxide poisoning. Carbon monoxide, as we seen in anemic hypoxia, is a colorless, odorless, and tasteless gas. It is produced by incomplete combustion. So it will bind with hemoglobin. So hemoglobin carries oxygen around your body with help of blood. So carbon monoxide has 200 times more affinity towards oxygen. So it will prevent oxygen from being carried to body. Even small amount over time can cause serious problems. Exhaust gases from piston engine may contain as much as 9% carbon monoxide. Symptoms of it. So initially, symptom is inability to concentrate. Then you have headache. You feel dizzy. You feel nausea. Then impaired vision. You feel tired or weak. Your decision making skills decreases. You have mood swings and you remember very less. You have impaired memory. This is important. This is an accident exam. You have flushed cheeks and cherry red lips. Ultimately, 11th one is the most severe one. which can lead to seizure and loss of consciousness. What are the actions to be taken if you have carbon monoxide poisoning? So, if you are in an aircraft, so first step is turn off cabin heating. So, cabin heating will introduce carbon monoxide in cockpit. About trainer aircraft, if we talk about Cessna, so they use a muffler shroud heating system. So outside air passes around hot exhaust, and the muffler will provide warm air and it enters the cabin. Now, if there is a crack in the muffler or heat exchanger system, so your exhaust gases will get into your cabin heat system, then ultimately in your cockpit. Second is open cabin ventilators. So there's fresh air flow in the cockpit. Third, if you have oxygen, use that. Fourth is land as soon as possible. Take medical aid. Says do not fly until you are cleared by a. So this was your hypoxia related things we talked about. Description I have uploaded some questions so you can practice them in the video. If you like, please share and subscribe with your friends. See you in next one.